Understanding schizophrenia. A brief overview. Schizophrenia is a complex mental illness. It affects how a person thinks, feels, and behaves. It's hard to tell what's real and what's not. People with schizophrenia may seem like they have lost touch with reality. This can be distressing for them and their loved ones. Common symptoms include hallucinations, delusions, and disorganized thinking. Hallucinations are seeing or hearing things that aren't there. Delusions are false beliefs that are not based on reality. Disorganized thinking makes it hard to focus and follow conversations. Schizophrenia requires lifelong treatment and support. With the right help, people with schizophrenia can live meaningful and fulfilling lives. Stepping into virtual worlds. An introduction to VR. Virtual reality, or VR, is a technology that creates immersive, computer-generated environments. Users wear headsets that track their head movements. This allows them to look around the virtual world as if they were actually there. VR can create a wide range of experiences. These can range from playing games to visiting distant countries. In recent years, VR has shown promise in healthcare, particularly in mental health therapy. VR offers a safe and controlled environment for patients to confront their fears and practice coping mechanisms. Therapists can tailor the VR experiences to address specific symptoms and needs. This makes VR a valuable tool for treating a variety of mental health conditions, including schizophrenia. A new reality for therapy. VR and schizophrenia treatment. VR is transforming how we treat schizophrenia. It allows therapists to create simulated scenarios. These scenarios can help patients manage their symptoms. For example, a patient who experiences auditory hallucinations can enter a virtual environment. This environment can help them practice coping strategies. VR can also be used to address social withdrawal. Patients can interact with avatars in a safe and controlled setting. This can help them build confidence and social skills. VR therapy for schizophrenia is still in its early stages, but it has the potential to revolutionize how we treat this complex disorder. Section 4. Shaping Perceptions, VR, and Mind Manipulation. The term mind manipulation might sound alarming, but in the context of VR therapy, it refers to the ability to influence perception and behavior in a positive way. VR can create realistic scenarios. This can help patients challenge their delusions and hallucinations. For instance, a patient who believes they are being followed can experience a virtual scenario. This scenario shows them that they are safe. By gradually exposing patients to their fears in a controlled environment, VR can help them rewire their thought patterns and develop healthier coping mechanisms. Section 5. Rewiring the mind, VR, and synaptic plasticity. Our brains are constantly changing and adapting. This is called synaptic plasticity. VR can be used to promote synaptic plasticity in the context of schizophrenia treatment. By engaging patients in therapeutic VR experiences, we can stimulate the creation of new neural connections. This can help improve cognitive function and emotional regulation. Think of it like this. Each time a patient successfully navigates a challenging VR scenario, they strengthen the connections in their brain that promote positive thinking and behavior. VR, in essence, acts as a mental gym, helping patients strengthen their minds and regain control over their lives.